Now, the first hip mobility exercise we're going to do for internal rotation is simply seated internal rotation while keeping this leg straight. So I'm going to be in this long sit, that's what we call this. And so I'm going to bring this right leg out to the side. I don't need this right now. And I'm just going to be thinking about turning this femur in. Now this might seem really simple, especially if you have suitable range of motion. But the thing though that I'm trying to do is I'm trying to keep this thigh bone down as I turn this in. What happens is if you're limited in range, you're just going to want to move that ankle. Try not to do that. You're going to try to stay in one line, and then this whole femur is turning in toward midline, and I'm coming back to center. In toward midline, coming back to center. The other thing that I'm focusing on is making sure that I'm trying to sit as upright as I can. So you might need to kind of push yourself forward to give yourself assistance, because you don't want to be in this rounded position, okay? We want to focus on trying to strengthen in a functional position. So I'm going to do 10 repetitions of turning this leg in. I'm pausing for a second and then coming back to midline. Pausing for a second, coming back to midline. And really think about, how am I moving? Am I initiating the movement by turning this thigh in? I'm trying to also make sure that I'm not hiking that hip up either. And now do both sides. So for me, it's much easier and I have much less resistance turning in on this right side. I'm trying to use this right side to teach my left side, oh hey, here's how you should move. The progression to make this a little bit harder is if you bring this leg out to the side and now you try to turn that leg in. So the more abducted I am, the harder it's going to be to try to turn this leg in. And I really can barely move. This would be the progression. So for me, I'm okay with staying here to start, because this already feels pretty restricted. I can actually even feel it kind of like cramping up along the side here, like where my TFL is and where my glute attaches, my glute med attaches. Remember, you need the mobility before you start to improve the stability and strength, so don't skip this step.